in action.
Sorry,
No worries. All
it's a
right.
little delayed, but we'll get it. Yep.
Can you guys hear me good? Yes.
Give him
Okay,
a
good.
thumbs up. Yep.
Awesome. Yeah, so it seems like there's a little bit of leg, so I'll just kind of start going, and if stuff starts getting out of whack, just like start screaming at me or something. So yeah, like Chris said, I graduated in 2020. Very excited to be back here, exercise sci alum. Um, and yeah, she just wanted me to kind of talk about, my journey through SMSU, things I did to help prepare for grad school, and then also talk about like med school, now that I'm in residency, kind of what residency looks like. And also like I do PM&R, and then also interested in sports med. So I'll kind of touch on those topics. And I have a presentation here. And let's see if I can share my screen.
I might have to make you a co-host. Oh, it worked.
You guys
Oh,
seeing
wow.
that?
Yes.
Perfect. Let me go in presenter mode. Awesome. So like I said, that's my name, and that's kind of some of the stuff I'll be talking about. So I have no financial disclosures. So again, going through my journey, like I said, I went to SMSU, 2020 grad, majored in exercise science. I subsequently went to med school at Western Michigan and graduated there a couple months ago. And now I just started my residency at the University of New Mexico. And I had pulled out my old football headshot and then my headshot from med school, showing kind of my progression. And then just kind of talking about my time at SMSU and some of the stuff I did to help prep for grad school and things I did in the classroom and outside. So, like I said, I was an exercise science major. On top of that, I did take some extra courses to help prep for grad school. There were some specific ones I chose for med school, but for those of you thinking like PT, probably some different courses that you would want to take. Definitely something to talk to your advisors about. And I would highly recommend looking at the schools that you're interested in and seeing what courses they recommend to do during undergrad. And then on top of that, I was also studying for the MCAT on the side, that's the med school admission test. I think only med schools use that, and then I think like PTOT and Cairo use the GRE. But again, something to talk to your advisors about. And then things I did outside the classroom to help kind of prepare me for med school and to help stand out on an application to help me look like more of a competitive applicant. As you can see here, I was a member of the football team. Also, I was a member of the exercise science club, was president for 2 years. And then I also was a science tutor in the academic commons. And then I helped out in Dr. Cleveland's physical therapy clinic. That's a great opportunity to get some hands-on experience and kind of find out things that you do and don't like. And then finally, I did my best kind of get involved in research. We had a research group going at the time, so I was able to help out with some seniors projects and to do my own project when I was a senior. Got my name on a few posters, and definitely great opportunity to take advantage of in undergrad, because once you're in grad school, research is something that's really nice to do, but there's a lot less time to do it. And then just briefly touching over the kind of the format of med school for anyone who's interested. Like I said, kind of in preparation, did those extra courses in the MCAT. And then the other big thing to do in preparation is getting some like hands-on experience. So like shadowing, or if you work like a job as a scribe, things that just kind of show your actual interest in medicine. For those of you that might be considering med school, something that I wasn't really aware of till like I had already made the decision, and it was like in the rush to apply, but there's both DO and MD med schools. DO stands for Doctor of Osteopathic Medicine. MD is medical doctor. The degrees have different letters, but when it comes down to it, it's the same level of degree. I'm an MD, but I work side by side with DOs every day, and we do the same job. The only main difference is really for DOs, they do in their med school, they're trained in this thing called osteopathic manipulative medicine, which is kind of something that's kind of pretty cool and something I wish I had maybe learned, but we didn't offer it at my school. The overall rotations are supposed to be about the same, but I will say with MD schools, you usually are attached to a hospital with your school. So most of your rotations are right at that hospital, whereas with DO, it's more so on the student to find the rotation. So that can mean going somewhere across the country to find a spot. So a little more stressful in that regard. And then the board exams, they follow a similar structure, but they're just slightly different since the DOs have that extra OMM education. On top of that, just going through the general format for med school, it's 4 years. The first 1.5 to 2 years are didactics. So that's like your typical classroom learning. Third year is like your core rotations like family medicine, internal medicine, surgery, psychiatry. And then fourth year, you do a couple advanced rotations. So that could be things like ICU medicine, like intensive care, things like that. But you have a lot more time for like electives to explore areas that you're interested in, and then time for residency interviews, which is a big part of the year. Um, oops. Let's see. And then just talking broad strokes about residency, they're very variable depending on the specialty you go into. So it's not really worth getting too much in the weeds right now, but depending on the specialty you pick, could be 3 to 7 years. You're still in training, so you still feel like a med student at times, but it's a higher level of responsibility. There's more, more tasks and duties put on you. But the nice thing is that you're finally getting paid instead of having to pay to go to school. And finally, kind of getting into the meat of it. So talking about PM&R. So that's the residency program that I am in, and that stands for Physical Medicine and Rehabilitation. And I'm assuming most of you probably haven't heard of that because I hadn't at your time. And, even when I was in med school, a lot of my classmates hadn't heard of the field. It's pretty small. And one of the interesting things about it is just that even though it's like a well-defined field, it's very hard to kind of communicate to people what exactly us PM&R doctors do, because we have a hand in a lot of different other medical specialties and we overlap a lot. The biggest fields we overlap with are probably like neurology and non-operative orthopedics. And the best way I can think to describe it is that if a cardiologist is a heart doctor, a physiatrist is a function doctor. So colloquially we're called physiatrists, otherwise just called rehab doctors. But what we do is very focused on overall function, optimizing that. And there's a lot of different ways that we target it. And that's why we overlap with a lot of different fields. So it's a 4-year residency program. So I'm in my first year right now, and it's a relatively procedure heavy specialty. So we do a lot of like EMG and nerve conduction studies. So that's like when you kind of poke a needle into a muscle and hear what it sounds like and kind of interpret, if there's any neurologic damage, muscle damage, things like that. And then we also do a lot of injections. So we can do those with ultrasound or with fluoroscopy, which is like a fancy form of X-ray. And sometimes we just do injections without any imaging. And we do a lot of joint injections, spine injections, and then a lot of things for like spasticity treatments. That could be things like Botox. We work with like intrathecal baclofen pumps, a lot of different things that we do. And then we also do a lot with like prosthetics and orthotics to make sure people have the proper equipment to help optimize their function. And like I said, we have a hand in a lot of different specialties. So when it comes to after residency and like subspecializing, so that'd be like doing a fellowship, there's a lot of different directions you can go. I listed some of the more common ones here. So like sports medicine, which is what I'm interested in, pain medicine, spinal cord injury, brain injury, peds rehab, cancer rehab, a lot of different options. And then we also work in a lot of different settings. So our kind of bread and butter setting is like a rehab hospital, and that's like a little different than the typical hospital that you think of, where that's somewhere that someone can go if they've like recently been hospitalized and now they're medically stable, but they've just been deconditioned because they haven't been moving around that much and need to get a little bit stronger before they can go home and actually take care of themselves. So they could go to a rehab hospital there where they can work with like physical and occupational therapists to get their strength back. And in those settings, we're the primary doctors taking care of them. On top of that, we are in like the typical hospital settings that you think of. In there, we're usually more on a consult basis. So a patient could have like a primary medical team, but then they can have us consult and take a look at the patient and see if we would recommend any medication changes or like offer any procedures that might help the patient while they're in the hospital. And then there's a lot of outpatient settings that we work in just with like the range of the specialty, a lot of different clinics, like sports medicine clinics, neuro rehab clinics, general PM&R clinics, a lot of different settings there. So that's just kind of a brief overview of the field. And I'm lightly going to touch on sports medicine as well, since that's something I'm interested in going into afterwards and also goes along with exercise science very well. Really only going to talk about like kind of on the medical side of things. So sports medicine is a fellowship level training program. So that'd be something that you do after you do a residency. So after I complete my PM&R residency, I'd probably do a sports med fellowship for a year or so. And the different fields from medicine that you can go into sports med from, if you're trying to be on the surgical side of things, that'd be like your orthopedic surgery. And on the non-surgical side of things, that'd be family medicine, PM&R, internal medicine, emergency medicine, and pediatrics. And then let's see, I'll finish the presentation. I didn't put too much on here because I was hoping to hear what questions you guys have so we can kind of focus it towards what you guys are interested in hearing about. So finally, I just listed a couple of resources that you guys can look at. These are just professional societies that, for one, they're very like helpful to learn about these different fields. And for two, it's nice to become members of these societies to have access to their info, and it looks kind of good on a resume just because it kind of shows that you have an interest in these fields. And like if you joined at this certain time and have been a member for a couple of years, that's something that like does look helpful. I think for all exercise science majors, I think the ACSM is a great place to start. It has a lot of good information there. I was a member back when I was at SMSU. And then going forward, if you guys are interested in medicine, the AMA is a good place to start. If PM&R sports med sound interesting to you guys, I think the AAPM&R especially has a lot of good information about the field, as well as the AAP. And then for sports medicine, the main organization there is the AMSSM. Yeah. And a lot of these, I'm not sure for ACSM, they do have like college students should have a free membership, if I remember correctly. For the other ones, I'm not sure if they have free memberships for college students or if it doesn't kick in until it's like med student level. But yeah, these are great places just to look at to get some more information. And yeah. So I kind of try to keep it broad because now I want to hear from you guys and see what questions you guys have about any of this. So.
Is this open floor, Chris?
It will be open floor. Yeah, we'll just let he's gonna end that so that you can see everybody, John.
There we go. Perfect.
There we go. Okay, so I'm just gonna change this so you can see everybody better. Yeah, when John was talking about the American College of Sports Medicine, I believe a student membership might be $15 or $30. It's not much at all. And it's super, super helpful. We go, and we'll probably talk about that later as a club, but we'll go to the Northland chapter. That's Minnesota, North and South Dakota, and Nebraska. This year it's going to be in Mankato or Winona. I can't remember. That's in the spring. It's Mankato. That'll be in the spring. And then the national convention is going to be in Atlanta. I went to Boston. It was great. Learned a ton. So awesome. All right. So yeah, now we'd like to open it up to the floor. Ask lots of questions. Like I said, John is kind of a busy guy, so we really appreciate the fact that he took time out here. So ask away.
Do you think that the XI courses that you had to take set you up well, like to go into medical school?
Yeah, I do. Especially like I knew going into med school that I wanted to do physical medicine and rehabilitation and go into sports med. And I think particularly exercise science was good in that regard. There's some of them are less applicable, but I think overall set me up well. I still had to take a couple other like biology and chemistry courses on top of it just to hit the required prereqs and be prepared for the MCAT. But I really liked that the exercise prescription and principles training and conditioning, those courses, like actually got hands-on experience working with people. This was more in a training setting, but still like seeing people and interacting face to face, which kind of helps you in a clinical world. And then I do think the extra exercise physiology courses were beneficial as well, just to have more of a physiology background heading into med school. So yeah, I definitely think that it translated well. There were still courses I needed to take on top of it, but I think it did set me up well.
Why did you choose med school over physical therapy or T or something else like that?
I couldn't quite hear that, but it sounded like, why did I choose med school? Is that right?
Yeah, why did you choose med school over like physical therapy or OT or something like that?
Yeah, that was really just kind of a feel thing for me. I actually came in for the first 2 years of college. I was thinking I wanted to do PT. I did some shadowing. I really liked PT, but I just like got through it and just kind of figured that I just kind of felt like it wasn't exactly where I wanted to be. So then I did some shadowing with medicine, and that's where I felt more comfortable, I'd say. It was tough because Marshall didn't have any practicing PM&R providers, so I had to, shadow in some other fields, but just learning about PM&R, it sounded like it aligned more with what I was interested in. Um, and I really liked it because it's still very closely related to like PT and OT. We work very closely with them. So I still felt like I was connected there, but it was just the setting more so that I liked. And I would say off that too, it's very important to figure out what you do want to do, because they're not light choices. PT and OT school, I believe, are both 3 years. Med school's 4 years. So kind of important to explore the different fields and figure out what you do like, because it's a long course, and you want to figure out where you want to be, instead of like finding out years down the road and having to make a change later.
How would you describe school?
Sorry, I didn't quite catch that.
How would you describe your time in grad school and residency so far?
Okay. Let's see. Grad school, that was definitely a grind. That was it was tough. I felt like I kept myself pretty busy in undergrad, but I was doing a lot of different things. So like, even though I was working maybe like 15, 16 hours a day, I like, I'd have a couple hours for football practice. I'd be tutoring. I'd be doing, exercise science club stuff. I was just like busy with a lot of different stuff. Once I got to grad school, it was like the same amount of time, but it was just school. And that's something I struggled with. So, it was med school was tough. Like there's no way around it. I definitely felt like I struggled more with that than once I've gotten to residency now. I definitely feel it's gotten a lot better. There's less of that, feeling like, oh, I just worked a 12-hour shift. Now I still need to study for 3 hours. It's, I don't feel as compelled to do that anymore, which is nice. But you know, it's grad school. It's just by definition, it's going to be a higher level than undergrad. So it's just kind of something you need to be prepared for and understand, like there is a responsibility, and the requirements are higher, and just kind of need to be mentally prepared for that. I will say though that it does feel a lot better now that even though I'm still working about the same, I'm actually getting paid. So
That's a plus. That's a plus. John, in one of your slides, you had gap year, but you didn't really address it.
oh yeah.
What did you want to say about that?
Yeah, that was just something I skimmed over because I wanted to leave time for questions.
Yeah.
I would say, and I don't know how common this is for like PT and OT in med school, though. It's gotten pretty common to take at least like one gap year between undergrad and going into med school. A lot of people will do that for one, like if they don't get into med school the first year, or if they just need a break or like are concerned about their application, because applications cost a couple $1,000 depending on how many schools you apply to. And if they're concerned that might not look quite as competitive, want to get a year or two of like work experience under them, like as like a medical assistant or something else, just to beef up the resume. So that's a very personal choice. I personally, like, I had done SMSU. I had done four years of school, and then I had to take one semester off just for timing wise and come back for the spring semester of my 5th year. So since I had already pushed it to 5 years, I just wanted to go right into med school, but a lot of my classmates had taken a year or two off. Really, it's just more of a personal decision where you're at in life, and what you feel is best for you.
Thank you. I appreciate that because I think gap years are more common and
Mhm.
it's not as a negative thing. I think, years ago it was considered negative, but I want you guys to
Yeah.
all hear that taking a gap year is not a negative thing.
Yep.
Do
And
you
I
feel
would,
like that semester you took off kind of helped you reset a little bit?
I do. Yeah. It was a little tough because as soon as I came back after that is when COVID really took over. But
Oh,
definitely like
yeah. That,
yeah, definitely having that break though was helpful. And the one thing I would say, at least for med school, when you're going to a residency after, when you're applying for residency, it can sometimes be considered a red flag if you have to take a break during med school. So just something to be aware of. Like, so if you want to take that gap before, that'd probably be better to do than, get a year or two into med school and figure out that you need to take some time off.
Did any of your friends find
So what was that?
Did any of your friends find it hard to go back after year?
Still can't quite hear something about my friends.
Did any of your friends like not want to go back after they took their gap year?
Um, let's see. Like go back to school.
yeah. I think what some of the students are concerned about is if they take a gap year, they're not going to want to go back. That's the concern I hear. Is that what
Yeah.
you mean? Yeah.
Yeah, it's tough to say because when I was in school, there like most of my friends were planning to go to either PT or OT school, and I think most of them went right in. I don't think anyone particularly took a gap year. One of my friends took a year or two, but he's in PT school now. And then one of my friends also was in I think he was thinking about going to med school, and then he ended up taking some time off and then didn't end up going. But just talking to him, I wasn't convinced how sure he was of med school to begin with. Like it was something that he was thinking, but not necessarily dead set on. So I wouldn't necessarily say it's something um that should scare, like, you shouldn't be scared to take one because you're scared that you won't want to go back, because if you don't end up going, there's probably a reason for it. So
True. And you don't want to go in being burnt out.
yeah. And the other thing is you don't want to jump in if you're not sure that it's something you want to do, because it's something, I mean, my first semester of med school, I accumulated more debt than my 5 years at SMSU. And, that's something that like you have to understand you're making that commitment. So it's not something you want to be like 1 foot in, 1 foot out when you start it.
What was your work-life balance like between school and residency and everything else?
Are you talking like now during residency or in med school or when?
Kind of, I mean, you can both, I guess. What
Yeah.
was, school life balance and work-life balance like?
Yeah. Well, briefly, like at SMSU, like I said, I kept myself pretty busy. I was usually on campus like from at least 8 a.m. till 5, 6 p.m. You know, I was personally like, if I had an hour between classes or like 2 hours between classes, I wasn't going to go home. So I tried to get some other work done. I was involved in the clubs, had football practice. So I was at school usually at least like 12 hours a day. when I went to med school, let's see, the first 2 years when it was like very classroom based, it's kind of a grind because it's just a lot of lectures you have to go through. We didn't have to go in person to most of them, and we could watch the recordings, but like they pile up fast. So I mean, like, I didn't work a job on top of it. I don't think anyone like really works a job during med school because like school is your job. And that was kind of a change from undergrad because I was able to do small things like tutoring on the side. And yeah, I would say I was probably, whether I was school or at home, from 8 a.m. to, gosh, I'd like to say I was only studying until 10, but a lot of times it was like midnight or later, like pretty busy, just like in the books. When I got to my third and fourth year of med school, when I was doing uh like my clinical rotations, third year was very variable, but still, roughly, 8 to 5 in outpatient settings, more like 8 to 7 in inpatient settings. And still trying to study for an hour or two when you get home. And yeah, so it gets to be a lot of late nights. I personally fell into that pattern where I'd stay up till 2, get 3 hours of sleep, and then when it got to the weekend, I'd sleep until like 4 p.m., which is not what you should do. But yeah, med school I would say definitely was like the toughest to keep that balance. Now that I've gotten to residency, like life is so much better. I've been getting the best sleep I've gotten in years. Like I still work like when I do like inpatient stuff, like our first year is very like internal medicine heavy. So like we have like 12-hour shifts. I still get home, maybe do a little bit of studying, but take a couple hours, just kind of chill, decompress, and get 6, 7 hours of sleep and still feel good to go for the next day. So I would say med school was definitely the worst, and residency is for the first 3 months I've been here has been so much better.
Nice. John, this is gonna be the last question. Will you take that question from Dr. Greenfield? Can you read it in the
Oh,
chat?
okay, let me see.
Can you see it?
Yes, okay. Let's see. So were there any content areas I felt underprepared to handle when I got to med school? Just looking for recommendations. I would say in particularly no. Biggest thing from that is that like on top of the exercise science major, I did take like biology and chemistry courses to help prep for the fields that like med school would look for, particularly like adding on organic chemistry 1 and 2 and biochemistry. And then the biology courses I added, I believe were genetics and microbiology and immunology. Those were the extra ones I took. And I would say I felt very well prepared. And really the best way to gauge that was for my MCAT, which I perform very well with the MCAT, I would say. But even when it came to getting to med school, there's only a certain level of preparation you can have because they're going to throw a lot of info at you anyway. But I felt like I was definitely on par with my classmates. And I think the biggest advantage I had, a lot of my classmates, some of them had never had an anatomy class, and that really got them. It was a little tougher for them to get up to speed when we did anatomy. And I think having the anatomy courses plus all of the anatomy that gets just passively put in through the exercise science program very well prepared me. I remember before our first anatomy exam, actually, I had forgotten that like in addition to the muscles that we had all of the bones on the exam. So I hadn't studied those at all. But like when we ran through it the night before, I already knew everything because we had hammered that in so much through exercise science. Um, on top of that, I elected to do the microbiology and immunology courses, and I think that definitely gave me a leg up on some of my classmates in med school because we presented those two courses together in med school, and some of my classmates did not have any of those in undergrad. And it was a big struggle not necessarily a struggle, but like they had to work a lot to understand those, like how they interact. And just like all of the info with that, and I felt having that basis really gave me a leg up when it came to that course. But overall, I wouldn't say there were any specific deficiencies.
Awesome. All right, John, thank you so much for taking time out of your busy day. Let's give him a round.
All right, no problem.
Great to
Thank you
see
for having
you.
me.
Take
Yeah,
care.
good to see you. All
Tell your
righty.
parents hi.
I'll do my best. Yeah, my mom says hi. All righty. Yep, bye.